In some ways, it was a happy coincidence. The whole state is moving much more towards performance-based, outcome-driven process budgeting, and it's a national trend and it's a trend for the Commonwealth. So all of the agencies in the Commonwealth were asked to do strategic plan. All of the secretariats, so Health and Human Services was asked to do strategic planning. They asked all of the human service agencies. But for us, the timing was right. The last strategic plan we did was in 1998. And so we were due. And what's interesting is in the 1998 plan, all of the things that we said we were going to do, we did. And so it was very much a platform for what we're trying to do in this plan. It really set the stage and created a lot of capacity to really reach with this plan. Well, the state set deadlines that were pretty short in their horizon, 3 months to have basically a version of the plan on the table. So we made some decisions up front that we had limited opportunities to meet as a group and to do this work, and that we wanted to be as inclusive as possible. We didn't want it to be just the DYS senior staff getting in a room, somebody goes and writes a plan over the weekend. We wanted to use the strategic plan as a vehicle to bring people into the conversation. So that led to some strategy. How are we going to accomplish this in such a small window of time? How are we going to reach out to all of the stakeholders in the system, kids, families, our partners in doing this work? There we sort of laid out the features, I think the general, conceptually, about some assumptions we made about the program, about the project. And one, for example, the last strategic plan was very focused on the agency, facilities, licensed teachers, licensed clinicians, making a better agency. The decision up front in this effort was we really wanted to express it in terms of outcomes for kids.